delighted today to have Zandile Landu, one of our authors in the PHCFM journal, and she is going to tell us a little bit about her study on primary healthcare nurses' knowledge, self-efficacy, and performance of diabetes self-management support, which was published with Talita Crowley. So, Zandile, before we get into your article, can you tell me a little bit about yourself? Who are you and where are you?
Thank you very much. I'm Kholusani Landu, Zandile. I work in KSD Sub-District OR Tambo in the Eastern Cape. I'm currently working as a primary healthcare manager. So I supervise a cluster of clinics, 8 clinics. So I have to supervise them, look at the stats and everything, basically just oversee that the facilities are running smoothly. Okay,
great. So you're actually a manager of the primary healthcare system in one sort of, I guess, sub-district in the Eastern Cape. So Zandile, can you tell us a little bit about this study? Why was it important to do this study?
Well, it's part of my job to look at the performance of facilities, look at indicators and everything else. So there's an increase in the number of cases diagnosed with any of the chronic diseases, your diabetes, hypertension, and so forth. Even in South Africa generally, it's actually on the rise. Then that is why I decided to do a research on diabetes, in particular self-management, because I watched in clinical practice that much more focus is on medication, and there might be a gap when it comes to the 9-drug management. Thus, I conducted the study.
Great. Also a particular interest of mine, actually, improving self-management of diabetes. So what was the specific aim of the study? What was it you were really trying to do?
It was to evaluate performance of self-management support, knowledge of diabetes among primary healthcare nurses, as well as performance of diabetes self-management in patients in primary healthcare setting.
Okay, so and how did you go about doing the study? Just give us a very sort of brief overview of the study design.
The method that we used, it was a quantitative method, a cross-sectional and simple correlational design. So we had questionnaires about the demographics. Then we used 2 tools that are validated: the diabetes basic knowledge test. The second one was the self-management, self-efficacy and performance of self-management support. So we distributed those tools in each facility because we visited facilities. The study was conducted during COVID. So we tried our level best to keep ourselves safe as well as participants.
Cool. Okay. So so tell us, what did you actually find? What were the key findings from the study?
When it comes to knowledge scores, we found out that they are quite knowledgeable. The mean scores were very high. It was 11.9 out of 14. The original DBGT tool has 54 questions, but we selected 14 that were related to etiology, management, signs, and symptoms. So they were quite knowledgeable. And we discovered that nurses who had a qualification in primary health care, that is a postgraduate diploma in primary health care, had higher knowledge scores than professional nurses without the qualification. And also nurses who have been working in primary health care for a longer period and actually working in the chronic stream were actually much more knowledgeable as well. What was concerning was about 45 participants did not know the causes of hyperglycemia, which is quite concerning because they are expected to manage patients in cases of emergency, they should actually be able to detect, diagnose, treat, and they need to equip patients. That is, when they're at home, what signs are they supposed to look after so that they can report quickly for medical services.
Okay, so Zandile, just to finish off, what then do you think really are the implications of what you found for diabetes care? I mean, particularly in a context like yours, which is quite a difficult context in the Eastern Cape.
Looking at the results of the study, there was no association between knowledge and self-efficacy and performance of self-management support. So I believe much more training is needed so that we can boost the nurses' confidence and sensitize them around the concept of self-management, what it entails, how it can actually help them in clinical practice in terms of reducing workload, because most of our facilities, it's quite packed and we have few nurses and support services. And guidelines also needs to be reviewed. When you look at our APC, that only includes 3 aspects of the 5 A's. So if guidelines are reviewed and then we include all 5 A's, I believe there might be much more improvement.
Great. Thank you so much. And I wish you well with I'm sure this is a topic that you'll need to continue pursuing. Certainly close to my heart to try and improve care for diabetes, because as you say, I mean, at the end of the day, it's not just about taking tablets. You've also got to understand your condition, and you've got to understand how to sort of look after yourself. So great. Thank you very much. And we look forward to your next article.
Thank you very much, Prof.